Unfortunately, capsular contracture surgery is more complicated than the primary augmentation. There are a few risks. First, there is a risk of recurrence of capsular contracture. We know that it's more common in revisions, and once a person has been shown to have capsular contracture, they do tend to be prone to getting it back. The second risk is implant malposition. Capsular contracture causes tightening of the scar tissue, and for women who have a mild form of capsular contracture, they may actually prefer the position and appearance of their implant on the chest because it can look higher and more perky than a natural breast implant without capsular contracture. So for some patients, even if the surgery is done perfectly, they may be dissatisfied with the after effect of the placement of the implants on their chest. Next, there is a risk of asymmetry. Capsular contracture can be an asymmetric process. It can happen on one side rather than the other, and it can happen to different degrees from side to side. This can mean when revision surgery is done, the breasts do not look exactly the same after. And this is a risk for many patients undergoing this revision surgery. Finally, there is a risk of the regular complications of implant surgery, such as infection, bleeding, fluid pockets, and complications from anesthesia.